My name is Tabitha Mounteer. I'm a nursing student at the University of South Alabama, and today I'm going to be performing a wet to dry dressing change. So the first thing that I'm going to do when I walk into my patient's room is I'm going to verify the orders on the patient's medical record to make sure that this procedure was actually ordered for this patient. So I've verified my order. The next thing I'm going to do is verify my hospital's policy to check and make sure how this procedure is supposed to be performed. And I'm also going to gather all of my supplies that I need for this procedure. So the next thing that I'm going to do is I'm going to perform hand hygiene. And then I'm going to verify that this is the correct patient using two identifiers from the medical record and the patient's armband. So I'm going to use the patient's name, which is Jaguar Jones, and the patient's medical record, which is 417-6352. I'm also going to note that on the patient's armband and on the patient's medical record that there is a known allergy to penicillin. So the next thing that I'm going to do is I'm going to explain this procedure to my patient, and then I'm going to offer any privacy that I can to my patient by closing a curtain or closing the door. So the next thing I'm going to do is perform hand hygiene using soap and water. The first thing that I would need to do would be remove any jewelry that I may have on, and then push my sleeves up away from my wrist, as well as a watch if I'm wearing one, push it up away from my wrist. The next thing I want to do is inspect my fingernails, making sure that they are shorter than 1/4 of an inch, according to the USA College of Nursing uniform policy. I'm going to inspect my cuticles, my hands, and also my forearms, making sure that there are no cuts, abrasions, or open lesions. So the next thing I'm going to do is turn on the warm water. I'm going to wet my hands, and I'm going to apply 3 to 5 milliliters of soap. I'm going to lather, making sure that I wash my palms, the back of my hands, and the inside of my fingers 5 times each for 15 to 20 seconds. Next, I'm going to clean under my fingernails. And then I'm going to rinse. The whole time I'm keeping my hands below the level of my elbows. And now I'm going to dry my hand, taking a clean paper towel and drying from the fingertips down to my wrist and discarding above the waist, and doing the same for the other hand, drying from my fingertips down my wrist, discarding above the waist. Now I'm going to take a clean paper towel and turn off the faucet and discard above the waist. 2 instances that you would use soap and water hygiene would be after coming in contact with a patient who has a spore-forming microorganism such as C. diff, and also if your hands are visibly soiled. 2 instances that you could use an antibacterial rub would be before and after putting on clean gloves, and after coming in contact with inanimate objects in a patient's room, such as their furniture. So the next thing I'm going to do is position my trash can beside the patient's bed and perform hand hygiene, always after touching the trash can. Next, I'm going to raise my bed to a comfortable working height, lower the side rail, position my patient into a comfortable position. Then I'm going to apply gloves. and goggles. Now I'm going to remove the secondary layer of the wound covering, pulling the tape of the covering gently towards the wound. Now I'm going to face the secondary covering away from the patient with the dirty side facing up. I'm going to assess the drainage on the covering, checking for the type, the amount, the color, the consistency, and also whether there is an odor present or not. Next, I'm going to remove the inner dressing from the wound, placing it on the secondary dressing. I'm going to observe the wound, and I'm going to make note of the size, the type of tissue that I see, whether it's necrotic, granulation, or slough. I'm going to also note if there is any odor present. Next, I'm going to palpate the peri-wound area, assessing for any redness, edema, and then noting whether the patient reports any tenderness while I was palpating. The next thing I'm going to do is discard of the dressing inside of my gloves, touching glove to glove, and skin to skin, pointing down towards the trash can and dropping it in the trash can. So the next thing I'm going to do is I'm going to open my kit. I'm going to remove the sterile field and place it on a clean, dry surface, making note of the 1-inch border around the field that is now considered contaminated, and anything that is hanging off of the table is also considered contaminated. So next, I'm going to take the contents of my kit and dump them onto the sterile field, making sure not to touch my container to the sterile field as not to contaminate, and also keeping my equipment well inside of the 1-inch border of the sterile field. So the next thing I'm going to do is check my expiration date on my saline to make sure that it's not expired. I'm going to palm the label of the saline, remove the cap with the inside facing upward, and then I'm going to gently pour saline into my container, making sure not to splash my sterile field, and also making sure that the rim of the bottle does not touch the container so that the bottle does not contaminate. And then I'm going to recap my saline and set it aside. So next, I'm going to don my sterile gloves. With my non-dominant hand, I'm going to grab the inside cuff of my dominant glove, and I'm going to lift it away from the paper and insert my dominant hand. And then with my dominant gloved hand, I'm going to reach inside of the cuff of the non-dominant hand, pick it up away from the paper, keeping my thumb pointed away from my body, and pulling it onto my hand. Once I have both gloves on, I can readjust, touching the fingers if needed. So the next thing that I'm going to do is I'm going to arrange my supplies, making sure that they stay inside of the sterile field. And then I'm going to take my gauze and drop them inside of my saline, making sure not to touch the edge of my container so that I do not contaminate the gauze. So next, what I'm going to do is I had to wake my computer, so I did break sterility while doing that. The next thing that I'm going to do is I'm going to demonstrate how to clean an intact suture line. So the first thing that I'm going to do is I'm going to assess the suture line. I'm going to note the size, the borders, and I'm also going to note whether there is any drainage present or not. So to clean the intact suture line, I'm going to take a wet gauze and I'm going to wring out the excess fluid, and then I'm going to place the gauze in my hand where while I'm cleaning the wound, the patient's skin is not going to touch my sterile glove. So I'm going to clean from least contaminated to most contaminated, and I'm going to clean from top to bottom. So the first thing I'm going to do is clean the suture line from top to bottom, and I'm going to discard above my waist, and then I will repeat that process, cleaning each side of the wound, which is considered to be the most contaminated. Cleaning from top to bottom, dropping in the trash above my waist. Wringing out excess fluid. Cleaning from top to bottom and dropping in the trash above my waist. Next, I will take a dry, sterile gauze and I will pat dry the intact suture line and then dispose of that as well. So the next thing I'm going to do is I'm going to pack the open wound. So I'm going to take a wet, sterile gauze and I'm going to wring out the excess fluid, and then I'm going to gently fluff the gauze before I pack the wound. I'm going to place the packing inside of the wound, making sure not to touch the inside of the wound and not to touch the peri-wound area with my sterile gloves as not to contaminate. And then I would repeat this process if needed enough to fill up the wound area. And then once I've done that, I will take a dry sterile gauze and cover the wound area. And then I will take the ABD pad, making sure to only touch the outside and not letting the inside touch any other surface as not to contaminate it. I will lay it on the wound, and then I will remove my sterile gloves, pulling from glove to glove and skin to skin, and dropping them in the trash can. The next thing I'm going to do is I'm going to take my tape and I'm going to first measure and then tape down the ABD pad. Making sure that it's secure, and then normally what I would do was take a piece of tape and write my initials, the date and the time of the dressing change, and I would put that on the dressing. And then the next thing that I would want to do would be I would want to position the patient back into a comfortable position. I would lower the bed back to the lowest position possible, and I would raise the side rail. I would perform hand hygiene, and then I would discard of all of my materials. And then I would have to document my findings. So for the intact suture line, I would document the size, the approximation of the borders, and also if there's any drainage present or not. For the open wound, I would document the drainage and the drainage's type, amount, color, consistency, and whether there was an odor present or not. I would document the size of the wound, excuse me, the tissue that was present inside of the wound, whether it was granulation or slough or necrotic. I would also document whether there was any odor, if there was any redness or edema that I found while palpating, and also whether the patient felt any tenderness while I was palpating. And then I would also document how the patient handled the procedure. And that concludes my wet to dry dressing change procedure.